what do you think separates people from being the ones that are feeling stuck and lost in life to being people that actually are happy and flourish?
Well, I think that what separates people from the idea of happiness and actually experiencing joy is that they know how to reclaim their joy in the moment. They're not people who think, I'm going to be happy when I get a job or when I pay off my debt or when I find my soulmate. They're people who, in the moment every day, they've learned that, let me not eat my lunch in front of a screen. Let me go for a walk and feel the breeze on my skin. Let me look at the sunset and appreciate how wonderful it is to be alive in this moment. This is what I mean by reclaiming joy in those little points in life and not leaving your joy on the table because you're chasing this idea of happiness.
And what do you think we've been lied to about the concept of happiness that is actually making people miserable?
I think people delay happiness for an event to happen. Happiness is dependent on the external. So when things happen to you, then you become happy. But the science actually shows us that even when those things happen, we're still unhappy. And so if we reframe our thinking process and we get tapped into the sensations of what it is to be a human, right? When we take a rest, we're not looking at our phones, we're sleeping, getting that deep, yummy sleep and waking up feeling restored. When we're talking to our loved ones, we're actually listening and nodding and making eye contact and holding their hands. These are all these human sensations that we were born with for a reason. Human beings were born with the DNA for joy. It's built into our code. And we have sensations for this very reason because joy allows us to get through difficult situations. It allows us to survive challenges. It allows us to be resilient, but we're not tapping into our joy because we are believing that, well, I'll be happy when XYZ happens. And even when those things happen, we're still unhappy.
And it's definitely easier said than done, right? Like I know times when I've been broke or miserable, I'm like, well, I'll be happy when I can actually pay my bills, or I'll be happy when my mental health gets better, or what have you. Like, how can people, like from a science perspective, dig deep during those moments and actually feel good about themselves, even when their circumstances are kind of telling them not to?
I agree. It's very difficult to access joy when you're stressed. I don't know one person who's stressed out who's also joyful. And in the science of research, in the science of happiness in my lab, when we add up joy points, we actually ask people about tension and stress and anxiety. And many people think, well, isn't that anxiety and depression is happiness and anxiety is stress? No, we're learning that the brain is so interlocked and that it's really difficult for humans to access joy and that feeling of well-being and positive well-being when they're stressed. And that's why even when you go to these countries where people have nothing, right? They're literally running to the spring to get water. They don't have electricity. Maybe sometimes they don't have food. They can still access joy in some communities, right? Because they have trained themselves to calm that sense of stress and to, in spite of their challenges, tap into things such as joy to become resilient. And I've been there too. I was a broke medical student. I came to the United States with very little. And even when I had very little, there were times when I could tap into things like spirituality that would allow me to get through a difficult time and to feel joyful. It doesn't mean your problems are solved, right? You still got problems, but you're able to get through them a bit easier because you're able to tap into joy.
And I think people misunderstand success because they assume that when people are successful, they have money, they're thriving in life, that there's no way they could have problems. And we've obviously seen this to not be true with celebrities and people who are super successful and the mental health problems that they've had. But from a science perspective, and your experience as a clinician, somebody who works on this stuff all the time, how can somebody be successful, but deep down, like they're lost, hopeless, and not fulfilled?
And this is the great part about my work. You know, I teach tools that can be applied to just about everyone, anyone. What I recommend is that we all understand the science of our own happiness. So there's only going to be one you. There's only going to be one me, ever, in the future of the universe, in the history of the universe. Why are we applying tools that work for other people to ourselves when we don't even understand the science of our own happiness? And there's a tool that I talk about in my book heavily. It's called the biopsychosocial model. And it sounds super complex, but I like to make it a bit easier and simplify it by imagining that, okay, every human being has a fingerprint, but all of our fingerprints are unique. They're not identical. Every human being has a biopsychosocial, and no biopsychosocials are identical. They're all unique. So when you look at your joy and you look at your situation, I want you to imagine that you can approach increasing the points of joy in your life through different avenues. So biologically, what are the things that are getting in the way of your happiness from a physical, medical point of view? I use myself as an example. Biologically, I have a thyroid condition. So if my thyroid is out of whack, then I'm not going to be happy. But other people may have things like autoimmune conditions or high inflammatory states or chronic pain, right? So biologically, where are you losing your points of joy? Women in midlife are going through perimenopause and menopause, and their hormonal fluctuations are going up and down. Harder to access joy because biologically those things are in your way. Psychologically, what's your past trauma? What's happened in your past to you? What has happened to you? What are your attachment styles? It's really difficult for some people to access joy if they're constantly in fight or flight or they have unresolved trauma that's weighing on them unconsciously and consciously. And then socially, what's happening in your day-to-day life? Who are you around? Who do you spend your time with? What habits are you engaging in? Do you drink a lot? Do you smoke? Do you not get a lot of movement? What are the foods you're eating? Are they highly processed? Are they not really supporting your brain? So socially, what's getting in the way? So when you think about it, you realize there are so many areas where I'm losing my joy. And that allows you to strategically focus on an area of your life where you can add those points back. So there are multiple avenues to joy. And the reason I started talking about this is because I'm a psychiatrist. People come to me typically after they've gone to therapy with a psychologist and they've tried everything, and then they get referred to me for medication. And then when people start medication, sometimes they're like, oh, it's not working. I don't feel better. And they're kind of tunnel vision, like meds are the only way. And if it doesn't work, I'm hopeless. Well, the biopsychosocial model is really empowering because you see that, okay, medication is only one aspect of that fingerprint. That's just the biology. But there are all these other avenues that we can try to increase your points of joy. And I use the term points of joy because in research, we literally add up points to see if you are becoming happier. We'll ask you things like, when you ate your food, did you savor it? Was it yummy? When you took a rest, when you took a nap, did you wake up feeling refreshed? When you were feeling stressed, were you able to calm that stress response? When you were lonely, were you able to connect and feel seen and heard? All of these things are points that we add up, and then we determine whether or not you're becoming happier. So it's very different than how most people think about happiness that are not in research. They're looking for this destination, whereas we're happy to get you as many points as possible. And when you reframe your way of thinking about becoming happier and you're like, wait a second, I can approach it from this biopsychosocial model that's unique to me, there's hope. Maybe today I'll get 2 points here and maybe tomorrow I'll get 3 points here, but I'm getting closer to this idea of feeling happier.
And a lot of this stuff can go unnoticed, right? Especially when you're super successful and you're high functioning, which I know a lot of your work revolves around. Like, what are some of the subtle signs that might be overlooked that somebody's actually depressed, even if they don't realize it?
People don't know that you don't have to be sad to be depressed. You can just have something called anhedonia, which is a lack of joy, interest, and pleasure. In fact, in our manuals that we use for research, when you're going down the actual criteria for clinical depression, you have to have either a low mood or a sad mood or anhedonia or both. So you don't have to be sad. And I think that really shocks a lot of people, right? Because in our society, we think of someone as clinically depressed if they're not getting out of bed, if they're crying, if they look sad. We don't think about a lack of joy. And the term anhedonia has been around since the 1800s. Most people have never heard of it. But when I explain to my successful clients who come to my office and they're like, something's off. I'm not sad, but something's not right. And then I take them through my anhedonia rating scale, which is actually on my website. They're like, oh my gosh, I think I have anhedonia. They finally have a term for what they're experiencing because they feel guilty. They're like, why can't I feel joy? I have everything. I have a successful career. I have the family. What's wrong with me? And then when I explain that anhedonia is actually a clinical term, a scientific term that's been around for ages, you just don't know about it. They feel so validated. They feel seen. And then we can actually take the steps towards increasing their joy.
I think that we live in the society that equates being busy with success. Do you think that busyness is just a way for people to hide working on themselves or avoiding problems?
Many people are pathologically productive. They are constantly on the go. When they sit still, they feel empty. When they're not working and busy, they feel restless. And it's something that I see a lot with my high functioning clients. And what I found in the research, because I've conducted the first peer reviewed clinical research study in high functioning depression, is that there is a correlation between unprocessed trauma and pain and this busying yourself. So classically in PTSD, post-traumatic stress disorder research, when people have past pain, they avoid people, places, and situations so they don't get triggered. But with the high functioning folks that I've worked with, their way of avoiding is by distracting, by overworking, by overcommitting themselves. Excuse me. And it's different than burnout. With burnout, when you think about the brain in burnout, and I have my brain model here. When you're in the workplace setting is causing the stress with burnout. But when you leave the workplace, over time, those symptoms get better. The high functioning folks, when they're in the workplace, they have the symptoms, but even when they leave the workplace, they can't sit still. They're taking on a side hustle or two. They're constantly busy with their kids. They just can't sit still. So there's something internal that's leading them to busy themselves versus the burnout. It's caused by the external factors that's causing the symptoms. So unless you start tapping into that unresolved pain and trauma, that busying will continue until either your health gives, you actually do mentally break down and have a high functioning and have a clinical depression, or you start to cope in unhealthy ways like drinking excessively, coping in these ways that are just not adaptive.
I think when people are addicted to kind of being busy and achievement, they're chasing something. They're chasing validation. They're chasing, applause from other people. They're chasing money. What do you think deep down they're chasing on this pursuit, and which they focus on instead?
I often say to my clients, I say that you're chasing this idea of happiness, but you think you are chasing it, but you're really outrunning your past pain. And the reason I say that is because, as I've done this trauma research for over a decade, I think people don't understand how trauma and past pain can manifest in so many different ways, such as a lack of self-worth, an internalizing blame, an internalizing shame. There's a trauma inventory that's widely used by the VA hospital system called the CAPS-5, and we use it in civilians as well for measuring trauma. There are over 30 symptoms of the CAPS-5s, and one of those symptoms is that internalizing shame, blame, and guilt. So think about it. If you have past pain that you haven't resolved and you don't feel worthy of it, what are you going to do? You're going to deprive yourself of the daily joys that you earned. So these people are so busy. They're so busy, they don't even enjoy the things they worked hard for. They're constantly chasing things, or they believe they're chasing things. But what we have seen is that they're trying to outrun something they haven't processed. So you really have to slow down. You really have to face the thing that you're afraid of and deal with this past and process this past and feel the feels, because then you can actually start to access that joy that's missing in your life.
And generally speaking, what's the pain that people are trying to outrun? What's
Well, I
beneath it?
have a trauma inventory, again, on my website. I wanted to capture all of the possible symptoms of trauma. and to validate people because when I do research, it's overseen by the FDA, so I have to use the standardized uh, methods. And according to the DSM-5, which is the Diagnostic Statistical Manual for Psychiatric Conditions, trauma by definition has to be either life-threatening or some like violent assault or something really severe. And over the years, having people come in and talk about their trauma, and I'm saying, oh, it doesn't meet criteria here. Well, but I was in an abusive relationship. Did they hit you? Did they try to kill you? No. Sorry, that doesn't count. I mean, imagine how many stories I have to hear like a therapist and say it doesn't meet criteria according to the DSM. But I believe you. I know that this experience, this terrible relationship, this terrible bankruptcy, this collective trauma that you felt as a society, when things happened, those things shape the way that you view yourself and the way that you interact in the world. And I know they're emotionally painful to you and psychologically painful, but you don't meet criteria for the classic PTSD definition. So I wanted to capture all of these experiences in this trauma inventory. So I included things like, were you treated poorly because of how you, identified culturally? Were you rejected because of, your race? Were you ever in a situation where you didn't have food to eat as a kid? Again, it's not life threatening, but it's painful. I captured all these things like collective traumas. That was another one that came up a lot during the pandemic was people who had seen death or been quarantined and so forth. They were highly sensitized, but it wasn't meeting criteria according to this diagnostic. So people felt invalidated by the actual literature. So I wanted to include a bunch of experiences in there so people could validate that this was painful, it shaped the way that they behaved, and then start to heal from it. Because you can't heal if you don't even acknowledge that something has happened to you.
What is your stance on people that say, well, if you're achieving things and you're changing who you are, the past isn't going to matter as much? Like, do you think that there's any kind of merit to that?
I like to use myself as an example. I have 2 Ivy League degrees from graduate schools, honors, graduated with honors from college. Congressional awards. You just name it. But I was not facing my own past trauma. I was trying to outrun this past where I had very little, where at times I didn't even, the light bulbs would cut off, didn't have food, but I never processed it because in my culture, I'm from the Caribbean, it was like, oh, well, you made it. Why are you complaining? And I had never, and I've been in therapy for 10 years, and it took me, being in therapy for close to 10 years to understand how that past had shaped me. And I am a board certified psychiatrist, I don't think that people are fully conscious as to how past pain steps into the present, how it impacts your behavior. So for me, it manifested as I had to keep working. I couldn't turn down studies. Couldn't take a break. And I was outrunning this past pain because on a deeper level, I was worried about running out of resources. Never connected the two, right? And I don't think it's obvious when you're in it, you don't know necessarily how to identify the pain and you don't necessarily know how to address it. And I wanted to make this information available in as simple a way as possible, right? When people read my book, they're like, oh, it's so simple. I'm like, yes, I did that on purpose. I don't need to be fancy and show you, all of my education. I want you to be able to understand what's happening with you and to heal.
How can people heal from this idea that they're never enough, which we see a lot in people that are high achievers?
Well, in my framework, the 5 V's, the first V is validation. I liken validation to imagine you are in a dark room, you can't see anything, and you hear a loud crash. Some of us would start swinging, some would start screaming, some would start running. But if you turn that light on and you saw that, oh, it was just this vase that fell, I'm safe, you feel better. The first V of validation is acknowledging and accepting how you feel and your experiences without judgment. It's like turning the light on. on your experience, on your feelings. But many of us don't want to acknowledge it. We say, well, someone else is better off, or what do I have to complain about? We invalidate ourselves all the time. And it sounds so granulary, but I tell you, I have very intelligent people come into my office and they have a really hard time acknowledging what they felt, what they experienced. It's like they've built this guard around this painful past and they just don't want to tap into it. But when you get into the practice of self validating, you start small. With my clients, I help them from a physical level. I say to them, your first step of self validation is when you're sitting at your desk at work, I want you to at least name one thing that you feel during the day. Like if you feel stiffness in your back, I want you to say, my back feels stiff. I'm going to get up and walk. Or if you feel like, I know it sounds really primitive, but if you really feel like you really have to pee, I want you to say, I have to pee now. I got to go take a bathroom break, very basic things. But when you start to get into a practice of, this is how I feel without judgment, it is what it is, and you start to name it and accept it, then you start to go to the higher level things. Instead of saying, I'm angry today because I yelled at my coworker, you're going to be like, wait a second, that actually was not anger. I was actually very worried because the project wasn't going to get turned into this client and I was going to be ashamed. So now you named two things that are accurate emotions, shame and worry. Whereas before you mislabeled it as anger because the behavior looked angry. And then when you realize, wait a second, I was actually worried and I didn't want to be shamed, it allows you to actually take the next steps that you will not regret. Because, many of my clients will misname the emotions and then they feel guilty once they blow up at people. So self-validation, naming, accepting, and acknowledging how you feel without judgment is the first step.
And where do people go from there?
The second V is venting. So
Venting's
I
healthy? No, I'm kidding.
there are do's and don'ts. But with venting, I have people with a red balloon in my lab. They just take turns trying to push this red balloon into this tank of water. And 100% of the time, that balloon will pop up. Why? Because you can't outmath the numbers. You can't outmath physics. It will pop up. And I use that analogy because if you don't slowly express how you feel and let that air out of that balloon, your emotions will pop up in your relationships. It'll pop up at work. It'll pop up in your health. And there are do's and don'ts to venting. Now, I'm a psychiatrist. So if you pay me and you talk to me, you can say whatever you want, right? But you should not be venting to people in your life without, first of all, making sure that they're okay with it. So you want to ask for emotional consent. You want to say, hey, is this a good time? And you also want to make sure that you're not venting to people who are below you in terms of the power dynamic, like your kids. Like a lot of the parents I work with, they'll vent to their kids and then the kids are they're not going to say anything, but they're going to worry about you, right? They don't want you to not talk to them or attach to them, but they worry. It's not appropriate. And then, same with business owners. I say, your employees are not the ones to really be venting to because you pay them. They're not going to be like, shut up, boss. They're going to be like, I'm going to, well, the boss wants to talk. I got to listen. Then they're going to go home and vent to their family, So you really want to think about who you're venting to, asking emotional consent. Is it okay? Can I talk to you about this now? And having an intention, is your intention to seek some sort of resolution? You don't want to just be trauma dumping with no intention, right? And recent data has shown that when you do vent with intention and you're venting with empathy, you actually do feel better. But when you don't, you feel worse. They liken it to pouring gas on a fire, right? So when you do vent, you can do that verbally, but you can also vent using words, writing it in a journal. A lot of my neurodivergent clients, they won't necessarily want to talk to someone, but they'll write it or they'll, sing it or play it in a song. And then my pediatric patients, they vent by crying. A lot of the children that I work with ADHD, I tell the parents, let the child cry. They'll say, well, they cry all the time. I said, try this tool. Tell your child that while they're crying, that crying is okay. It's a healthy emotion. Sad people, when you're sad, you cry. People cry all the time. They will stop crying. But when you tell a child, stop crying, they cry more and louder, right? So we were built to be able to express our emotions, and venting can be done in different ways.
And then let's go through the last three V's. I think the audience is curious to learn what they are.
Well, the third is values. And values are things that give your life meaning and purpose. not things that have price tags. So, when I think about values for myself personally, there was a time when I would just chase all these accolades and the clout and all that. And it wasn't really making me feel happy. But, tapping into my community, spending time with my family, those are the things that really anchor me. And that's why I think many of us end up feeling lost and anhedonic, is because we've forgotten what the true values were. We're chasing things with the price tags and not the things that are priceless. So if you have a hard time identifying a value, I often ask, well, if you had 5 minutes left on earth, what would you do with that? No one says to me, oh, I'd like, drive around in a Porsche. They, they'll say things like, well, I wish I'd have 5 more minutes with my family, or, spend time in nature, things that are priceless. And so try and tap into those things as much as you can. And the fourth V, it's vital. So how do you support your body and your brain, because you only get one? And I did, touch briefly on how it's important to get good movement and eat foods that are supporting your brain, because there's a whole body of research now in nutritional psychiatry where the foods that you eat can either support your brain health and allow your brain to feel happier, or increase inflammation and make you unhappy. And so understanding these food groups, like the foods that are rich in omega-3 fatty acids, antioxidant foods, leafy greens, all those things support your brain health. But the other things in vitals that we neglect are things like our relationship with technology. Many of us are spending way too much time on screens, and we're not protecting our brains. And then our relationships with other people. The longevity research is showing us that that's really important for long-term health. So all these things support your body and brain, because you only get one. And then the fifth V is vision. How do you plan joy in the future so you don't get stuck in the past? And for me, I really encourage my patients to celebrate their wins. So let's say if they listen to this podcast and they're feeling as if they've learned something about the science of their own happiness, then celebrate your win, acknowledge it. If you get your kid to school on time, or you deliver a project on time, don't just go on to the next. Like, literally just do something for yourself. It could be taking a rest, putting your feet up a little bit, drinking your coffee in peace, but celebrate these wins and plan your joy so you keep moving forward instead of getting stuck in the past.
I've heard you talk about, and even throughout this conversation, you've mentioned that like success and achievement can be like a trauma response. And, that in a way it's like a form of self punishment. Like, how do you convince people of that when you see, you see how much joy like success can bring? Like, success can create generational wealth for people. Success can change the world. Success can, leave a mark in society, legacy, like all these things. Like, what is your message to people who say stuff like that?
They're absolutely right. I mean, I've seen it both ways. I've seen clients where they are successful, they're doing wonderful things, and they're also experiencing joy, right? They don't have anhedonia. But I've also seen the clients where on the outside, it's successful, they're achieving all these things, but there's a lack of joy. So the missing ingredient is joy. If you're having that anhedonia and everything looks great on the outside, that's a problem. Don't ignore it. And that's usually why people come to me. They've either lost the joy they once had, or they're experiencing this persistent joylessness, and they just can't figure out why. So, yeah, I would not knock success. Listen, I'm at a place in my life right now where I'm successful and joyful. And it was because I really did figure out the science of my own happiness. I figured out what works for me. I figured out where I was losing my joy and where I needed the most support. And I want everyone to be able to do that. There's nothing wrong with success. But two things can be true. You can be successful on the outside and lack joy on the inside.
Totally. And I'm curious to hear your thoughts on this. Like, the people that you're talking about, very smart, successful, solve problems, command a lot of like respect from other people. They're good at like what they do as far as like professionally and even like certain things personally. But the thought of them slowing down, even though they know it's good for them, like scares them. Like why? Like I don't like. Why is there such a disconnect between people that are wicked smart, good at solving problems, like understand this whole thing, but yet they're just afraid to like do that thing?
They have what I call all or nothing thinking. A lot of these folks have all or nothing thinking. When I say slow down, they're like, "What do you mean stop?" And I'm like, "Wait, never said that." Hold on there. They're like, "Oh, wait, yeah." It's the all or nothing thinking. Slowing down is not stopping, right? Slowing down is getting into the practice of you are a human being, not a human doing. It's you finish this big project. What have you done with your team to celebrate it? I've worked with very successful people, very like top of their game. And for weeks we talked about these projects and they were stressed and they got it done. And I said, "Well, what are you going to do now?" "Well, we have another one." And I'm like, "Hold up. What did you do with your team?" "Well, they're supposed to do that." Mm-mm. There's a saying, I believe it's, and I always get this animal wrong. The fish rots at the head, right? I think that's the saying. You are the leader, and if you are not fostering a culture of joy in your organization, you will be spreading anhedonia because anhedonia is contagious in the same way that joy is contagious. So when I work with these leaders, they do these little things like, okay, they finished a goal. They'll celebrate either with a team lunch or there's something that they do. They put it on the calendar and they do it together because they're getting into this mindset that there's more to life than these, hallmarks. There's more to life than these accolades. There's community, there's team building, there's each other. This is what's actually bringing the points of joy in the organization, right? This acknowledgement that we are human beings, not humans doing. And so slowing down doesn't mean stopping. It means literally smelling the roses, stopping to smell the roses and then moving on.
And I think this all or nothing mentality is definitely like something that people need to understand more about themselves because you will sometimes, I mean, not sometimes, a lot of times you'll hear like when somebody's unfulfilled in a job, just quit. Like it's the job, just quit. Like how can people tell the difference between whether or not it's actually something inside of them that's on them to fix versus like, a job that maybe they're not liking?
Well, I would say that the majority of the people I work with will not be thinking, let me quit. I mean, these are people who have been in these situations where they, on a deeper level, believe that they are not worthy of happiness. They believe they should be busy constantly. They believe that they should be grateful for this life, that they're living that is, not really experiencing joy. So that's very rare with the high functioning folks that I work with. But what I would say is that with a lot of my younger clients, who are just starting off in the workplace, they're understanding how important joy is. They prioritize it. And I did this series on social media about generations, and people laugh about it because um, all the different generations, they do approach happiness differently. The younger ones, they're more about, I need to figure out how to support my mental health. They're way more open to it. And so if they're in a work situation, they're more apt to leave and to find something that where they find joy. I'm not saying it's right or wrong, but it's just something that I've seen. Whereas the older ones, they tend to stick it out. It's part of how they were raised and also a part of, their demographic. But with the people that I work with who are trying to figure out whether or not they should leave or they should stay, usually what I tend to do is I work in the values part of the 5 V's. And I try to get them to tap back into a time in life when they were actually feeling joyful. So sometimes what we'll do is they'll bring in these old pictures and we'll try to figure out when it was that they were feeling and experiencing the most joy. And then we start to, act like historians and archaeologists of their past. And then we start to figure out who were they around? What were they doing? And how did they lose track of that? What was happening in their lives? And, I use this example in my book, a client who couldn't figure out what it was that used to light them up. And we found that they used to spend a lot of time in nature as a kid. but they don't have access to that now. They live in a big city. So we started to slowly, gradually expose them to nature. We first started off with the plant in the office. Then we had them looking up hikes online. Then we had them going to the Central Park, and then slowly building up to the weekly hikes. And then they started to feel more purposeful. And then by tapping into this value that they started to prioritize over other things that were the price tags, right? They realized that, okay, this job that they have is getting in the way of things that they value. So how do you figure out a balance? Because they still needed that job to pay the bills, but they wanted to figure out if there was a way for them to get into nature more with that job. And they were able to do that. So I think with people who are struggling with joy and whether or not to leave a place, figure out what it is that you value first. There's a diagram in my book with high level and low level values. And if you could start to tap into those values, but you're realizing that the situation around you is blocking you from accessing those values, that allows you to make a better decision as to what to do next.
And I want to talk about like the internal battle that people face. Like they feel like they're not doing enough, which we've talked about, like fuels them to pursue more. Like talk about like the guilt and the shame that can come along with like these types of things. I think a lot of it's obviously self-imposed, but it's still a real thing. Like what should people do instead?
I start very simple with their body first, because what I explain is this busyness that you have where you can't slow down. Let's try to understand it on a visceral, on a physical level. Because I explain to them that whereas someone else, when they're in fight or flight, they're revved up and they avoid things. When you're in fight or flight, you busy yourself. You can't sit still, you're working. So let's try and address that inner fight or flight, that inner restlessness first. So we'll do things like something I call the 5-4-3-2-1, and we'll practice it every day. So they get accustomed, again, gradually to the idea of slowing down by using this somatic technique. And when they practice it over time, they start to get more comfortable with this idea. So the 5-4-3-2-1 is you list 5 things that you can see. And usually I practice it. Let me see if I have water. Yeah, I do have some water in here. So I usually practice it with a tea or like a coffee or something flavorful. But when you're doing this exercise daily, do something simple like with a beverage, usually like a warm beverage, and you want to list 5 things that you can see. And the goal of this is to stay present and grounded and get accustomed to being still. So you're naming 5 things you can see. So I see the tea in here, the color of the glass. I see, my fingernails. I see the carpet. I'm really paying attention to the table, my surroundings. 4 things you can feel. I feel the warm glass. I feel the ceramic. I feel my feet on the ground. I feel the chair. So 3 things that you can hear. It's New York City, so I hear a siren outside, but I also hear the liquid in the glass, and I hear my fingertips, my nails on the glass. 2 things you could smell. Smell the fragrance of the tea, smell my hairspray, and then 1 thing that you can taste. All right. So I went through that because whoever's listening, they're probably like only thinking about sipping tea right now, right? It's an exercise that keeps you still and present, and it allows you to focus on 1 thing and only 1 thing at a time, to train your brain to prove to yourself that it is possible to be still. And that by training yourself to be still, you're calming that busyness down. Because like I said, that fight or flight, that outrunning your past pain, that manifests differently in high functioning folks. That manifests as busying. So doing these little somatic techniques to calm that busyness down, to center yourself, to be present, is a small way to slowly train your brain to get accustomed to the idea that nothing bad's going to happen if you just slowed down.
What do you think people are afraid of when they slow down?
I think many people are afraid of being unworthy. Like I mentioned, one of the symptoms of, this past unprocessed pain is just not being enough, that they're not going to be lovable, that they're not going to be wanted, that they're going to be rejected. Some people have scarcity trauma like me, that they'll run out of resources, that they'll, have nothing. But these are all inner fears that if you don't acknowledge them, if you don't validate them, the first V, you're never going to know what to do. You're going to constantly being outrunning something you don't understand, thinking that you're chasing happy. That's why it's important to start with validation.
How can people tell the difference between burnout and depression?
Well, that's why the brain um, model is really helpful. So when you're the burnt out brain in the workplace has a lot of pressure on it, right? The circumstances are causing the symptoms. But when you take the burnout person out of the workplace, their symptoms get better over time, right? Folks with high functioning depression in the workplace, they have the symptoms. But even when you take them out of the situation, they still have the symptoms. They still don't have joy. They still can't slow down. They're constantly busying themselves, right? They're humans doing, not humans being. And the way I think about it is burnout is this external pressure on the system. So when this external pressure is removed, the person gets better. High function depression, it's something internal that's unresolved. So it doesn't matter what setting you're in, you cannot relax. This is the person who, when they're on vacation, they can't be peeled away from their work emails. This is the person who's at a concert with their friends and they're still like trying to figure out this like side hustle, right? They just can't sit still. When they sit still, they feel restless. When they are not working, they feel empty.
Hmm. Would you call it, would you call it depression, or would you call it like an unhealthy relationship with dopamine, or is it the same thing?
Well, I call it depression because in the study that I did, the people that we looked at had symptoms of depression, but they didn't meet the checkbox at the bottom, which is you're lacking functioning because they're over functioning, or you're in distress, significant distress, because you're actually pathologically productive on the outside, right? And so I wanted to understand, you know, what is it about these people? They have these symptoms, but they don't meet criteria. Why is it that they're like this? And it's really from a preventative standpoint because in psychiatry, we're a little bit behind, in terms of what we're seeing in other parts of medicine. In other parts of medicine, the doctors are saying, don't wait for stage 4 cancer, let's catch it before it spreads. Don't wait for the hip fracture, let's prevent osteoporosis, right? But in mental health, we're still saying, well, you could have all these symptoms, but if you don't meet the criteria of breaking down, come back when you break down. I wanted to change that. I don't want people to break down. I want them to identify this lack of joy, this anhedonia, and I want them to prevent the breakdown. And that's why I am educating about high function depression, because why are we waiting for people in queue to break down? We have to prevent it. We have to empower them. There's just not enough of us. There are not enough mental health experts out there. There's not enough providers. We need to teach people how to prevent these breakdowns.
Speaking of things breaking down, there's people that when they get into their 30s, their 40s, their 50s, they're like, it's too late. My brain is so far gone. I can't fix it. It's just the way I am. Given what you know about the brain, like what's the process like of somebody not feeling numb anymore, not feeling empty, even though they have for like years or even decades? Like how quickly can somebody expect to change their brain?
Well, the brain is always changing. There's something called neuroplasticity. The brain is constantly changing. And I work with people who have treatment resistant depression, the clinical depression where they've tried everything. They've tried so many medications. And yet we are still in the research and innovation phase with them. We have psilocybin studies right now going on in my lab for these individuals. And they will say, I've been on antidepressants since the 70s. And it's like, you haven't tried psychedelics. There's always hope. The way that we think of the brain is so different than we used to think about it differently. We used to think, I love this brain model. We used to think, okay, depression is here and anxiety is here and trauma is here. And we're learning that it's connection. The brain is connected. It's the connectivity that we really try to seek out right now. We're trying to improve those connections. We're trying to make the brain optimal. So there's always hope. Even if you think I've tried everything, it's just happiness is just not for me, do not give up. We are learning new things about the brain every single day.
If you were to kind of create a pathway for someone and they had to like do everything that you said. And they were somebody that was either going to have a little refresh in their life, restart, or maybe there's somebody that's fresh out of college and they're entering into the workplace. Like, what kind of things would you have them do on a daily or weekly basis to give them the best chance possible to be successful and happy?
The first thing you need to do is understand the science of your happiness. Where are you losing your points of joy? That biopsychosocial model, it's taught to medical students. It should be taught to everyone. Understand where you're losing the joy in your everyday life. Where are you going to focus your efforts the most? If you're in college and you're young and you have no medical problems, what are your social habits like? Who are you around? Because you may not have medical problems, but if you're around someone toxic, they're draining your life source, or if you have past trauma, let's say something bad happened to you in the past and you're constantly in fight or flight. Well, it's hard to be joyful when you're constantly stressed. So let's figure out how to unpack that and to soothe from that pain. But if you're someone who, let's say psychologically, no past trauma, socially, your environment's okay, but biologically, you have medical issues, autoimmune conditions, that's where you need to focus, your effort. So there's always hope. There are all these avenues using this fingerprint, the biopsychosocial, based on the science of your happiness, because there is only one you and there will only ever be one you. So take the time to understand the science of your happiness.
One of the reasons that I think people enjoy making money and growing in the workplace, excuse me, is because they can kind of like measure it. Like fitness, you can measure like how fast you run. You can measure how many push-ups you can do in a minute. You can measure how long you can hold a plank. You can measure all these things. What's like the accurate way to measure like joy and happiness in your life? Because it's all subjective, right? Like you could have a crappy day and then take a happiness inventory and questionnaire, and then by that definition, you would be labeled as unhappy, but maybe you just had a bad day. So how can people realistically gauge whether or not they're actually happy?
Well, you're talking to someone who deals with numbers all day long because I do research. But what you're talking about is interesting. It's funny because before my daughter's school closed, one of her last assignments was about why humans love numbers. And one of the assignments was about how humans used to collect shells, and then shells became cumbersome, and then they would try to trade. We need numbers as humans. We needed to count money in order to figure out value. But the abstract has always been difficult for us. And that's why in many of our cultures, we have gurus who all they do is think about the abstract and think about philosophies, and then they whittle it down for us to simplify it for us. But for those people in my practice, we actually do measure happiness using numbers. We use our anhedonia rating scale, and it is very powerful. I can't tell you how many people have felt validated from the scales that we use. They're like, I never knew what was happening. And, with my diabetes, you can see that hemoglobin A1C. With my hypertension, you could see the blood pressure readings. But with my depression, you can't see it. It's not like you can image the brain and see it. The science is just not there yet. We have correlations with the science of imaging brains, but there's nothing hard and fast yet. So the scales are really powerful for my patients. But the other metrics that I use for my patients is, what did the people around you say about you? The families that I work with, they'll say, they seem lighter. It's easier to be around them. You feel it. The teams that they work with, they will say, wow, something's different about you. So these are all metrics that, one can use. Some people really want the numbers. They want to use the rating scales, but others, they measure it based on the feedback they're getting from those around them. And depending on you, if you're someone who can't access joy because you're constantly stressed, one of the tools in my book that I use is to listen to your body. How does your body feel? Many of my patients, they have no idea that they're carrying so much of their internal struggles in their back and their neck. But then when they start to feel more relaxed, they're like, I must be doing well because my body feels better. So we all have our different metrics. And that's why it's important to understand what your science is. What is it for you? Because again, there's only one you. So these models can apply to everyone, but everyone has an individual model for themselves.
What role do you think social media has played in people's ability to actually be happy?
A huge role. I mean, I use socials to educate people, but I also warn about the dangers of social media. There was a study that came out of one of the University of Texas schools earlier this year, where they took adults and they removed the smartphone capacity from their phones. And what they found was that for 2 weeks, just having these simple, somewhat like flip phones, like back in the day, 2 weeks away from their smartphones, where they were able to just get on socials and the internet, and it was as if they were treated with an antidepressant because their points of joy and the measure that they used went up significantly. And so what they found was that these folks were spending more time talking to each other, spending more time sleeping, spending more time in nature, spending more time moving, right? Remember all those points of joy that we used to measure depression? They were getting more of these points just by not being on their phone. So, being on phones can be very, very detrimental because it takes you out of the physical sensations of being human that actually bring you joy from all these different avenues. But it's also something that what I've found a lot of, especially my younger clients, they spend a lot of time looking at themselves. So you're looking at your face all day long. You're looking at you instead of others. There's something called the autoscopic phenomenon in psychiatry, where psychotic patients, people with schizophrenia, bipolar psychosis, they'll see themselves across the room and it creates a lot of anxiety for them, right? Because it's unnatural to be seeing yourself that much. But people are looking at themselves, they're scrutinizing themselves. They're just like, it's way too much tech exposure, unnatural. We're not supposed to be on screen. So we're literally losing points of joy and experiencing this kind of tech anhedonia as a result of being on screens too much.
And how can people navigate this? Like, how can people like effectively, like, we're in this world where you can't just shut your phone off, all the time. I think that's unrealistic, obviously. Like, how can people use social media as a way to better themselves instead of letting it drain them?
Well, I was asked this question about 2 years ago, and I developed this acronym called RESET. I developed it initially for pediatric patients, but the parents loved it so much they started using it. So the R in reset is realize how it's impacting you. Is it causing you to be less productive? Is it causing you to judge yourself more, have low self-esteem, experience FOMO, right? The E is educate yourself. What is the recent data? We know there's a lot of data on children, right? But there's also emerging data on adults and how it impacts adult mental health. So try to educate yourself on the emerging data. It's coming out every day. There's a whole um, Stanford Zoom fatigue center based on like how unhealthy it is to be on video conferences all day long. Educate yourself. And then the S is strategy. What is your plan? Are you going to, as a family, only, limit it to certain times of day, not have screens at the dinner table, turn it off by 9, you know, only, follow certain accounts that make you feel good about yourself and unfollow ones that don't? What's your strategy? The second E in reset is expectations. What are you hoping to get out of this? Are you hoping to feel better about yourself? Are you hoping to be more productive, get better sleep, be more connected? And then the T is thoughtfulness. How was this whole process for you? Was it too flexible? Was it too rigid? Did it work? Reset can be very helpful as a framework for balancing your time on screens and in the real world.
What do you say to somebody that just feels like they're just too far gone, that they're just so miserable, broken, they failed too many times, they've been hurt in relationships? Like, what do you say to that person that just feels like they're never going to be happy?
Well, that's a reality for many people, especially with people with treatment resistant depression. And what I would say to those folks is, again, there's always hope. We are learning new things about the brain every day. I have an entire clinical research site dedicated to, situations just like that because we don't give up hope in research. We don't know everything. And so if you tried everything or you believe you've tried everything, I would encourage you to look at other options. Were you someone who's only been in one-on-one therapy? Have you ever tried a group therapy, a peer support group? Have you ever tried, something like, emotional support therapy with animals? Have you ever tried, psychedelic assisted therapies? There's always things. I've never met a patient who's tried everything, and I've been doing this for a while. So there's always hope.
There's always hope. And Dr. Joseph, I really, really love this conversation. I think people are going to get a lot of value out of this. If people want to connect with you, if they want to buy the book, they want to learn more about your work, where's the best place to do that?
Well, thank you. This was a wonderful conversation. You can follow me on socials, Dr. Judith Joseph, and my website, drjudithjoseph.com. And my book is sold wherever books are sold, everywhere. So please support me. High functioning. Overcome your hidden depression and reclaim your joy.
Amazing. Well, thank you once again for coming on the podcast.
Thank you for having me.